Hi there, I'm Nathan Turnbull, an orthopedic surgeon with Florida Orthopaedic Associates. Today I'm going to answer some patient questions about joint replacement surgery. One patient asks, when can I return to work after a hip replacement? Well, this is variable. It depends on what your occupation is and how strenuous your occupation is. I've had sedentary workers go back to work as early as 2 weeks. I've had patients who are able to work from home on the computer go back to work as early as 1 week. For the more strenuous jobs, the manual laborers, the patients that have to lift and carry things, their return to work is going to be a bit prolonged. As far as heavy lifting and carrying, you're really looking at around the 8-week mark. I've had some patients go back a little bit sooner, but really you're looking at 8-10 weeks at least. So it's dependent on what your occupation is, if it requires any lifting or carrying. Again, for sedentary workers, usually around 2 weeks. A lot of times they can go back to surgery, and sometimes even longer, up to 4 weeks. And then for the more labor-intensive jobs, it could be up to 8 weeks, give or take a couple of weeks. And if your occupation is somewhere in the middle, then somewhere around 4 to 6 weeks or so.